Hello, everyone, and welcome to today's program. My name is Rachel, and I will be taking you through vetting online medical information. So today we'll just be going through some principles on what to look at for credible sources, as well as attributes of a good medical website. And then we will be looking at some links on great sources for medical information. Oh, there we go. So just a general reminder that you always want to seek the counsel of a doctor or a nurse. So the benefit of seeking out online medical information is to provide you with a baseline understanding of healthy choices, risk factors, and possible health complications. That being said, only a healthcare professional can provide you with a diagnosis and a corresponding treatment plan. So think of a medical website as a supplement, not a substitute for an actual healthcare professional. Now, I do want to do a quick note about social media. So this is speaking not so much on a medical website, but medical information you might see on Twitter or Facebook or YouTube. That is put out there. So you just want to keep in mind that some information shared on social media is paid content supplied by biased advertisers. Before you take any health-related information you read on social media at face value, you need to investigate the content to validate its source. Even if account seems legit based on a social media handle or the account name, you should be cautious. Some profiles are well designed to seem authentic when their actual intentions are not what they seem. Depending on the social media site you are using, you may be able to determine if the account has been verified. For example, I just put what it would look like. So on Twitter, when an account is verified, there should be that light blue kind of fluffy cloud looking check mark next to the Twitter handle. And then on Facebook, it's also a blue circle with a check mark. So that's what you want to look for next to a name to know that it's a verified account. So if it's a doctor speaking, or if it's the account of like the CDC, it should have a check mark next to its name. So now we're going to talk about the foundational principles of credibility. So there are three. It should be science-based, it should be objective, and it should be transparent and accountable. And we'll go into a little bit more detail on that. So principle one, science-based. Sources should provide information that is consistent with the best scientific evidence available at the time and meet standards for creation, review, and presentation of scientific content. It should be acknowledging the limitations and evolutions of knowledge. It should clearly label information with the date it was last updated. It should be providing links to credible sources and provide citations for information shared and evidence to justify claims, as well as synthesize information from multiple sources rather than just a single source. Principle two, objective. Sources should take steps to reduce the influence of financial and other forms of conflict of interest or bias that might compromise or be perceived to compromise the quality of the information that they are providing. So they should keep health information separate from financial, political, or ideological messages. They should maintain independence from funders, and it should not include advertisements with relevant health information. Principle three should be transparent and accountable. Sources should disclose the limitations of the information they provide, as well as conflicts of interest, content errors, or procedural missteps. So they should be disclosing financial and non-financial conflicts, post public corrections or retractions of any information that they have put out, prioritize accessibility and equitable access to information, and provide a mechanism for public feedback. Okay, so now we're going to talk about the attributes of a good medical site. So you will see some overlap from some of the foundational principles I just mentioned, but there are 6 attributes: credibility, content, disclosure, links, design, and interactivity. So these are just things that you want to think about when you are on a medical website to see if it's actually trustworthy. Okay. Credibility. So credibility involves consideration of information source, currency, relevancy, and editorial review process. So the source of health information is one of the most important criteria to determine its quality and credibility. Does the site display the name or logo of the institution or organization responsible for the information? Does the site display the author's name, if relevant? Can you find the qualifications or credentials of the author? So sometimes this will require some digging. So one, if there's no author at all, I would say that immediately makes it a little bit iffy. And then as well, if it does list it, you might want to do some more digging to see if the author is a credible person to be speaking on medical information. You also want to look at personal or financial connections that present a real or potential source of bias. Anything along those lines should be disclosed. Once again, that's something that we talked about in the foundational principles. And they want to disclose sponsorship and motivation of the information provider. Is the site advertising a product or a service? So I also want to mention, so the source of a website's funding should be clearly stated or readily apparent. For example, the US government funds websites with addresses ending in .gov. So if you see .gov, that means that that site is funded by the US government. Educational institutions maintain .edu. So anything with .edu is funded by an educational institution. And then non-commercial organizations use .org and .com most often. It's also good to remember that although many legitimate websites sell health and medical products, keep in mind that the website's owner's desire to promote a product or service can influence the accuracy of the health information that they present. Looking for other sources of health information that is independent and unbiased can help you validate the accuracy of the material presented on a website. So what that's basically saying is you never just want to look at one source, look at multiple sources. And you obviously also want to make sure that if you're looking at a source that does seem like it might have a certain bias or go one way, that you try and look at different sources that might show a different point of view. So then we have currency. The date of which the original information is based should be displayed. The date of posting on the web should also be displayed. Medical information needs to be current because medical research is constantly coming up with new information about medical conditions and how best to treat or prevent them. Websites should be clearly posting the most recent date or review date. Even if the information has not changed in a long time, the site owner should indicate that someone has reviewed it recently to ensure that the information is still valid. So always make sure you're looking at up-to-date medical information. You don't want to be looking at something that's citing a study from 20 years ago because that information could have wildly changed. Relevance. Does the content of the site correspond to the information it claims to offer? Then review process. Does the site have a seal of approval from an individual or group commonly perceived as credible? Sites should state if the information provided has been subject to review, and if so, describe the individuals and process involved. Content. Content should be accurate and complete with an appropriate disclaimer provided. Accuracy. The site should identify the data that underlines the conclusions presented. Clinical or scientific evidence should be clearly stated. The framework of the study should be described so the layperson can understand it. So you don't want sites that are using too much medical jargon where you're very confused on what they're trying to tell you. You want it so they've made it clear that a normal person can understand what they're saying. And users must be aware that testimonials are not evidence. Then disclaimer. A website should have a disclaimer describing the limitations, purpose, scope, authority, and currency of the information. Sources of information should be disclosed. So for example, you need to know if the person who is writing the information, are they the ones who came up with the information? Did they do the research, or are they taking it from other people's research, which is fine, but then they should really be citing and linking that other source. A disclaimer should emphasize that the content is information, not medical advice, and readers should consult a health professional before making any health decisions. Then completeness. Does the information appear to be complete? Is the presentation of information balanced? Users should be wary of a one-sided view. Negative results and a statement of information not known should be included. Disclosure. Disclosure requires that a site inform users about any collection of data about them while at the site and how that data will be used. A website should clearly state the purpose of the site. Users should be informed of any collection, use, or dissemination of information associated with using the site. Users should be informed who is collecting what and who owns the data collected. For example, is a third-party participant collecting data, web servers, advertisers. So many health-related websites also ask users to subscribe or to become a member of the site. If any website requires personal information, it should disclose exactly how it will be used. For example, a website that wants to know if you have heart health-related concerns so that it can customize the articles you see upon logging in to focus on that may be of value to you. However, a website that wants to charge you for content or sell your personal information to a third party should be avoided. Four, links. Links should be included so that users can verify content on the site, and they should lead users to other reliable sources of information. Especially critical to the quality of a site are external links that will lead readers to other authoritative sources. Links should be included to other appropriate sites so users can read further on a topic. Content of originating site is more credible if it provides links to high quality sites. So at the bottom, I've just attached a couple of sites where you can check the safety of links. So you would just go to that site and then copy and paste the URL of whatever link might be included on a medical website. And then you can search and it'll tell you if that link is safe for you to open or not. Design. Design does not affect the quality of the content. However, it can have significant effects on the delivery and use of the information. Is the site logically organized for easy navigation? Is the site focused on the purpose and target audience? Does the information reflect the reading level of the user? Is there a search capability option? Because that can be very desirable on a website. And finally, interactivity. Interactivity does not affect the quality of content. However, it is important to provide contact information and feedback options on a site. A good website should include a feedback mechanism for users to offer comments, corrections, and raise questions. A website should be accountable to the users. Now, after going through those principles and attributes, we will be looking at some credible medical information sites. Now, some of them will be .govs, some of them will be .edus, and some of them will be .orgs or .coms. So we do just want to look at categories of health resources. So here are a list of more credible sources. So you have government agencies, established medical associations, universities and research centers, hospitals, publishers of medical journals and medical textbooks, and then with caution, individuals and private clinics. In that case, you definitely want to look further in on whatever information you're getting there and find other sources than just someone telling you something that they heard or something that worked for them. Some less credible resources: media articles reporting on research or sharing press releases, opinion pieces or editorials, columnists, bloggers, YouTubers, elected or appointed officials, breaking news pundits or commentators, celebrities in entertainment, sports, royalty, etc. First-hand accounts of quote-unquote miracle cures, and then causes and political soapboxes. Okay, so the first link to a credible source we'll be talking about is the website for the World Health Organization. I'm sure quite a few of these are going to be ones that you may have become very normalized with during the pandemic. So the WHO website offers a catalog of health educational materials, health recommendation for travelers, and news and updates on outbreaks and epidemics that could have widespread implications. Next, we have the Centers for Disease Control and Prevention, or the CDC. The CDC website offers healthy lifestyle recommendations, tips for mitigating the risk of common contagious diseases, and comprehensive overviews of a wide range of medical conditions. The US Food and Drug Administration. So the FDA website offers health information and news relating to human and veterinary drugs, biological products, medical devices, food products, cosmetics, and vaccines. So they have a really cool tool where you can search for recent product recalls, market withdrawals, and safety alerts, just so you're aware that the products that you are using are safe. Then we have Health Finder. So this site contains health information resources on a wide range of health topics selected from over 1,600 government and nonprofit organizations. It's sponsored by the Office of Disease Prevention and Health Promotion, which is a service provided by the US Department of Health and Human Services. PubMed. This is a free search engine accessing primarily the Medline database for references and abstracts on life sciences and biomedical topics. It's maintained by the United States National Library of Medicine at the National Institute of Health. So this is going to give you more scientific, like journal articles and very peer-reviewed information. Medline Plus. So there's two links on here. One is the general Medline Plus link, and the other one is their website for first aid information, because that's the kind of thing that could just come in handy in every day. Certainly if it's a simple enough injury for first aid, you don't need to contact your healthcare professional. So this will just give you some basic first aid tips and information. So this resource is produced by the National Library of Medicine, which is the world's most extensive medical library. It provides curated consumer health information in English and Spanish with select content in additional languages as well. Health News Florida. So this is run by the University of Southern Florida. It will keep you up to date on things that are changing in terms of science, technology, and politics that's affecting health in Florida. So it's a good site to verify health information you hear on the news. So if you're listening to some news media that you typically listen to, or whether it be national or local news, you can check that information and verify it on this site. Mayo Clinic patient care. So Mayo clinics are normally ranked as some of the best hospitals and clinics in the country. So they have a patient care site that has a database that allows users to search for health information such as symptoms, diseases, and procedures. And you do not need to be a patient to use the site. So this is for parents, caregivers, grandparents. This is called healthychildren.org. So it's run by a non-for-profit organization and provides information on children's health. This also has some interesting tools, including a kid's symptom checker. So if a child in your family is experiencing some symptoms of a cold, flu, but you're not sure if it's the cold or the flu, you can always put their symptoms into the symptom checker and they will give you the most likely results of what they may be experiencing. Okay, so here we have two links, both from Health US News. So one lists the top 16 hospitals in the state of Florida, and the other one gives rankings of the top 3 hospitals in the whole of the US by category. So it's only listing the top 3, but it's going in different categories. So for example, like health, heart surgery, top 3 hospitals, or ear, nose, and throat, top 3 hospitals, something along those lines. Then we have Florida Health Finder. So this site allows you to search for healthcare facilities by type, location, and price. So this can help you look for hospitals, assisted living, things along those lines. Okay. If you are interested in medical lingo, for example, doctors a lot of times just like to use their jargon. They seem unable to put it into words for a layperson sometimes. So if your doctor is telling you something and you just don't understand what they're saying, and you kind of want to know better, this site has which is a page on the Medical Library Association's website, provides a list of definition for medical terms and jargons. Retraction Watch. So Retraction Watch is a site that is run by a few scientists. It was started back in 2010, and they compiled a list of scientific journal articles having to do with, I'm going to say, not only medical information. It certainly has that, which is why it's on this list, but it also has stuff on social sciences as well. So you can find articles on psychology and other social sciences. So it's a database that provides an archive of scientific studies that have been retracted for one reason or another. So whether maybe it provided some misinformation, maybe whatever information that at one point they thought was true, further research proved that it no longer is. So if you ever want to check, once again, the credibility of a journal article put out there, you can check here to see if it's been retracted. The Florida Department of Health website. So this provides physical and environmental health information and news related to the state of Florida. So by environmental, that just means, you know, is the water supply safe? For example, it'll give you updated information on like, are we dealing with red tide right now or not? This is another one I'm sure people have been very familiar with since the start of the pandemic. The Food Composition National Agricultural Library for the U.S. Department of Agriculture. So this just provides you with information on the breakdown of food compositions. So if you want to know like nutritional values of the food that you're eating, you can look that up on this site. Okay, so here are just a couple of links to what is considered two of the best medical schools in the United States, which would be the Harvard Medical School and Johns Hopkins Medicine. Once again, Johns Hopkins, I feel, has been another one that people have become familiar with during the pandemic because they have, you know, their tracking site where they were keeping track of the numbers and spikes and stuff like that. Okay, so all these three links kind of have the same thing, which is they provide a compilation of health resources categorized by diagnosis, medicine, nutrition, and other medical categories that you can look into. Now, I do want to point out that the patient.info one is actually a UK website, but it's you know, perfectly safe, and I'm sure any information on there is still relevant to any human being who has health conditions. Okay, and then I have the best sites for drug and medicine. So that first link at the top will give you a list and link you to the 25 best sites for drug and medication information. And included on that list, and one that I wanted to highlight, is drugs.com. So that'll talk to you about prescription drugs, OTC medication, herbs, and vitamin supplements. You know, you can find out information like, is this the right pill? What are the side effects or interactions that are known with it? Are there FDA alerts on the drug or vitamin? And are there new drugs available on the market?